Hi, I'm Nicole from Roots Physical Therapy, and this is your intro to lower body foam rolling. As you can see here, we're going to start with the quadriceps, which is the muscle group found at the front of the thigh. We're going to break all these areas down into slightly smaller chunks so we can be a bit more focused and keep excessive pressures off of the upper body. As I finish this movement, you can see me bend and straighten my leg in order to add slightly more tension on the muscle and increase the release of this area. Next, we're moving on to the upper quadriceps, which is the same muscle group but closer to the hip joint. The easiest way to change position is to move the foam roller slightly higher so that we can work on a different part of the muscle without changing our position or upper body pressure. As you can see, I'm rocking my body back and forth, flushing out the muscle on just this one area. The more weight you put on top of the foam roller through your thigh, the more pressure you'll feel and the more release that you'll get. Despite the benefits of increased release, we want to be cautious about the amount of pressures we're putting through these muscles, especially early on in your journey to foam rolling. We'll now move on to the inner thigh area, which is a bit harder to foam roll, but is also extremely important. As the purpose of foam rolling is to release a muscle, we don't need to nor want to move the foam roller over any joints. During this inner thigh foam roll, also known as the adductor muscle group, we want to get as close to the joint as we can without going directly on top of it. As we move on to the outer side of the thigh, you should starting to be notice some patterns in how we foam roll. This part of the thigh is often referred to as the IT band. While the IT band is here, it's not a muscle in itself, but rather a stabilizing tendinous structure that we don't really need to foam roll so much. So for this foam roll, we're going to aim to get slightly in front of and slightly behind this area known as the IT band. You should be working on 45-degree angles from the direct side of your thigh, a little towards the quadriceps and a little towards the hamstrings. Again, we can break this movement down into smaller portions, like the lower outer thigh and the upper outer thigh, focusing on getting as close to a joint as we can without actually going on top of it. Next, we'll start to address the glutes region. You'll start by sitting on top of the foam roller and turning your body slightly towards the side that you're rolling. You can start by rolling with a straight leg, as is initially shown during the first 10 seconds of this portion. However, if you're looking for a deeper stretch, crossing that bottom leg over your top knee will help bring the muscle towards the surface and intensify the depth of the foam roll. Feel free to explore this area and find what's tightest on your body and needs the most love. You can always pause the video to increase the amount of time you're spending on one area if you feel like you could use it. Next, we'll continue on through the lower leg, starting with the calf muscle. If you struggle with pressure on your wrists, as shown here in the video, you can always support yourself on fists instead. Additionally, if you feel pressure through your calf muscle without lifting your hips off the ground, you don't need to do that until the muscle releases further. Throughout this clip, you can see me turning my body position a little towards the left and a little towards the right. This is how we address all of the different sides and aspects of the calf muscle without doing an independent foam roll, since the overall muscle group is much smaller than muscles on our thigh. Next, we'll move on to the hamstrings, which is the muscle group located at the back of the thigh. You don't need to follow this pattern for your own foam rolling. If you prefer to learn from this video and follow your own independent patterning, that's completely your choice. During this movement, you can see me using the fist position instead of the wrists position, which decreases a little bit of the stress through the area, but also makes us slightly taller so we can add a little bit more pressure into the muscle if we so choose. Crossing your opposite leg over is a choice here. The next part of the video will cover advanced foam rolling. In this video, we will address the same muscle groups with a bit more complexity and depth. Afterwards, I'll cover 2 bonus muscle groups for you to try. Starting again with the quadriceps muscles, which are found at the front of the thigh, we're first flushing through the muscle to help open it up. Then in place of the foam roller, we'll place the lacrosse ball on the lower thigh or any area where you have a specific muscle contraction that feels a bit more sensitive. Once you find a spot to work through, we won't roll on the lacrosse ball so much as trap that point down and then bend and straighten the knee to increase and decrease the muscle tension from the quadriceps over the lacrosse ball. This process can be repeated as many times as feels necessary and as many areas feel tight and that would benefit from it. As we move into the inner thigh, the same holds true for the foam roller and the lacrosse ball. We don't want to do any of this movement on top of a joint surface, only on the muscle that runs directly up to it. Since the lacrosse ball offers a deeper release for the muscle, we want to first warm it up using the foam roller and then replace that foam roller with the lacrosse ball for a deeper release. As you can see, you can always adjust the position of the foam roller and more follow a pattern of feeling it rather than forcing it when it comes to foam rolling. We want to know where we have the tension in our muscles by sensing what feels the most tender over the foam roller rather than following an arbitrary plan of where to put it. As noted previously, instead of rolling directly on the side of the thigh where the IT band is located or the iliotibial tract, we want to be 45 degrees off towards the front or towards the back in order to release the muscles that attach to this structure rather than the structure itself. Again, as the muscle tissue releases on top of the foam roller, we'll replace the foam roller out for the lacrosse ball and then perform a trigger point release using the lacrosse ball on one area of the body without movement. During this portion, we allow our body weight to add pressure of the muscle on top of the lacrosse ball and wait as the muscle releases and the pain decreases in that area. The next movement will continue with the glutes, which are on the outer corner of the back of the hip. You'll first start with increasing intensities of foam rolling before replacing the foam roller with the lacrosse ball again. Now with the lacrosse ball, you can see my body move side to side in order to move different muscle fibers on top of the lacrosse ball rather than trying to roll back and forth on top of it. For all of these areas of the body, as we move on to the hamstring area, I want you to get inside your own head and feel what you feel inside the muscle. Get a sensation for where you have tightness and what you want to put the lacrosse ball on in order to break it up even more. Once the muscle's warm from foam rolling, we'll again substitute in the lacrosse ball now that we know where we want to work a little deeper. Crossing your opposite leg on top intensifies the amount of pressure through the lacrosse ball and deepens the amount of release that you'll get. Moving into the calf, this is probably my favorite place to use the lacrosse ball in place of the foam roller, as it's easier to navigate and a deeper release for a tighter muscle group. We'll again first flush through the muscle and find the areas we want to work deeper in before substituting in the lacrosse ball instead of the foam roller. Once you find that area, you'll notice I point and flex my toe in order to pull my calf muscle on top of the lacrosse ball rather than rolling back and forth. This release can of course be repeated on any other areas that you find tight within the muscle as well. The last topic that will be covered in this video are 2 bonus movements that you can try for additional release. The first of these 2 areas is your shin. Of course, your shin bone is quite hard, but just off to the side of it, you have a soft muscle called your anterior tibialis, which really appreciates a little bit of love when it comes to foam rolling, especially if you're a runner. That means we want the foam roll to be off to the side a little bit rather than again rolling on top of a bone, as that's not beneficial. The same runs true for anywhere we foam roll on the body. We're going to start with an easy flush through the muscle using something more broad like a foam roller, less intense than a lacrosse ball or a knobbed foam roller. Then as the muscle's releasing a bit more deeply, we can spot treat areas that we find especially tight. As I mentioned, we can foam roll any muscle on the body. This includes the sole of the foot. Your foot is full of muscles that work all day long and usually aren't addressed when it comes to mobility and muscle release. Because the muscles of the foot are quite small, we're going to primarily use a lacrosse ball to release this area. This release can be intensified by adding more body weight over the lacrosse ball, such as changing from this seated position to sitting in a chair and leaning on your leg, or even standing. To summarize this video, foam rolling is primarily beneficial for relieving muscle stiffness, muscle soreness, increasing available joint range of motion, decreasing risk for injury, increasing athletic performance, and improving post-workout recovery. Using the principles covered in this video, you can explore other muscles and areas of your body using either the lacrosse ball or the foam roller at your discretion.